Hi, my name is Jeremy Garcia, and today I'm going to go over a new business idea for pharmacy regulation as it pertains to monitoring pharmacy benefit managers and their effect on prescription drug prices. As prescription drug prices continue to rise, many new regulations and legislative moves have been created to help combat this exact issue. However, are these new regulations actually saving anybody money? Of the new policy changes, pharmacy benefit managers, or PBMs, have been tasked to act as a liaison between drug companies and end payers such as insurers or Medicare D to not only manage formulary lists, but also to negotiate any possible discounts or rebates. PBM's job description is largely nondescript and requires very little oversight. Therefore, they act within the best interest of whoever is paying them or in the interest of maximum contracted buying power. Left unchecked, PBMs essentially are the gatekeepers of drug prices. Many pharmacies, without the resources or a full legal team, are at the mercy of how PBMs conduct their business. So, what do we do? As a pharmacy regulation consultant companies, our mission will be to help pharmacies provide their customers with the lowest cost of prescriptions by alleviating the concern that their PBMs of insurance contracts are acting in accordance to the interest of the patient. With this foundation, we envision to eliminate the concern that PBMs can withhold possible savings, increase the transparency between drug manufacturers' negotiations with PBMs, and act as a safeguard against rising drug costs for patients. Our mission includes naming that our patients are our number one concern. The healthcare industry is notorious for being non-transparent with their pricing and their payouts. We would like to rewrite the narrative on how our patients can see their flow of money as it concerns drug pricing and profiting. What we do. So the pharmacy regulation consultants will act as an independent consulting group that researches the pathway of drug prices from manufacturer and wholesale drug providers to pharmacies and how the role of PBM can alter, determine, or otherwise influence prescription drug prices. The services that we will offer will include to oversee PBM contracting and their adherence to honest and fair drug pricing. As more and more patients understand that our out-of-pocket drug costs have begun to creep up in ways that affect their everyday cost of living, more attention is going to be paid to how these prices have come to be and why they have crept up. As such, the research that we produce will become as transparent as possible to ensure that patients and pharmacies are aware of the extent of our findings. Additionally, as this information becomes more and more available, we will offer contract negotiation leverage and help pharmacies obtain better pricing power with the interests of the patient in mind. Contracts with insurance companies should include how they are able to obtain pricing schemes of medications and to what extent negotiations have been rendered. Pharmacy benefit managers were created to control the rising of drug costs, but their role may also be linked to the exacerbation of it without any oversight or governmental directive. Unnecessary rise in drug costs is reflected in passing costs to patients or insurances as pharmacies must market prices to cover their costs of purchasing and profit. The company may need to grow in size and in research capacity before they may come into total fruition. But as clientele begin to understand the importance we offer, our place in the market to provide legal advice and contracting power will increase. So as far as competitive environment, stakeholders within the model are pharmacies, insurance companies, PBMs, drug manufacturers, and of course patients. There aren't any kind of businesses that offer this kind of oversight. However, there may be pushback from researching this topic within the insurance realm and from drug manufacturers. Controlling price and being able to withhold this type of information has long been the power of these entities, and they have counted on the fact that many patients willfully ignore and are blindly trusting of them. Especially with the advent of PBMs, this information has been held as proprietary and therefore are allowed to be secret. However, this type of thinking is no longer acceptable. If patients cannot escape having to pay for medications, they are essentially for modern living, then their pricing schemes should be more transparent. We will demand that pricing information and the difference in buying power be revealed to create a fair type of market. For the laws and regulations, as a consultant group, we will be subject to the laws of privacy and confidentiality, such as HIPAA. Some information will likely be covered under private contract agreements, while others may be patents with gridlock certain information. For example, certain drug companies have a patent on brand medications and may begin as expensive medications to offset the drug research time and allow medication to infiltrate the market and begin other companies to compete with their to compete with them, which usually lasts about 7 years. With the passing of the Affordable Care Act in 2010, there has been increased pressure for drug companies, insurances, and the greater health care industry to concentrate efforts on making healthcare more affordable. With this law, the Pharmacy Regulation Consulting Company will pressure drug manufacturers and insurance companies to exact their definition on completing this task with their introduction of PBMs. With our investigation, we will add accountability for PBMs and to insurance companies. Our marketing strategy. Our appeal will be towards pharmacies. While our intention is to create an information master board, we understand that research and man hours will be the most labor-intensive and expensive part of our business plan. Therefore, our initial clientele will be chain pharmacies that have the most expendable funds to start up a program. We may take into consideration those pharmacies that are attached to insurance companies such as CVS Caremark or Cigna. These companies may have tighter hold on the job description of their PBMs. With the research building, the database to expand to smaller pharmacies will be greater appreciated. Since most pharmacies are not contracted with specific insurance companies, they are at the mercy of PBMs who do not have any allegiance to anyone. Barlas, in 2018, explains that rebates obtained by PBMs from drug manufacturers for favored placement on formularies obfuscate drug prices, and those rebates are rarely passed on to the ultimate consumer, which is the patient. This information will be our selling point. Independent pharmacies will likely be the toughest to convince that our service is beneficial. However, we may try to extend a business negotiation more than one independent pharmacy at a time so that they can take advantage of shared cost and shared information. Moreover, the pressure to create competitive at low prices against the size of chain pharmacies can be overwhelming. With our help, this information can be invaluable in the move to equalize the drug pricing regardless of market share, so that pharmacists can move away from worrying about price and costs towards creating a pharmacy that can concentrate on clinical outcomes and improve patient health care. For our HR plan, in order for our companies to begin, there is a need for base employees such as pharmacists, lawyers, research technicians, computer technicians, and data analysts. Pharmacists on board are essential to understand pharmacy layout, pharmacy laws and rules, and the workflow from drug manufacturer to patient sale. An attorney on board is essential to help with litigation and contracting. Having at least one attorney on board will help guide the company away from any sort of legal battle. Our company hinges on research and understanding data rather than collecting simple information, so research technician and data analysts are essential. Lastly, for the business to start and maintain itself, a highly skilled computer technician will be important to help store information and retrieve it. Most of the company will be an electronic-based type of company, so the information is more of a information property. For our first-year budget, salary will likely take the largest amount of first-year capital. Average pharmacist salary is around $120,000 per year. For an attorney, it's about $80,000. For both a research technician and a computer technician, it's about $30,000 each. For a data analyst, yearly salary is around $50,000, so that's going to be the bulk of the money. Although office space may be required, and so we might need to consider rent, most of the work can be done at home, and so it might not be an issue. The company may want to absorb or accommodate some cost of internet access or software access if people just choose to work at home. With sensitive information being shared between employees, we may need to purchase some sort of website domain or email domain with some sort of encryption capability, which usually runs around $15 a subscription per year. So that concludes my presentation about Pharmacy Consultant Company. Thanks.